Hello, I'm Cora-okkema, dairy educator with Michigan State University Extension and your host for the Heifer Academy webinar series. Before we go into the webinar recording, I wanted to sit here with you and let you know that today's subject is sensitive and may be difficult for some viewers. If you need to stop watching the webinar recording at any time, please do so. Thank you for watching the Heifer Academy webinar series, and if you have any questions, please reach out. All right, it is the top of the hour. So, good day, everyone, and welcome to a 2025 Spring Heifer Academy webinar series. We are both excited to have you join us for today's webinar, and we will be focusing on a crucial aspect of livestock management, making timely, informed decisions sooner for Youngstock health and well-being with Dr. Jennifer Walker. Dr. Walker is the co-founder and chief animal welfare officer of Kinder Ground. To go into some of the ground rules for today, there is going to be a poll question for everyone. So please make sure to interact with that. We would love to get your insight on that question. Feel free to drop those questions into the Q&A. And Dr. Jen, would you prefer answering that as we go along or save those questions for the end?
We could do, not to be difficult, we can do either. If you see a
Okay.
question, because I probably won't, and it seems like it's timely, like, oh, we should probably address that now, that's fine. Otherwise, we can wait till the end.
Okay.
Sometimes it's better to do it on the fly.
Perfect. Sounds good. As a reminder to everyone, a live recording of this session will be available in the Heifer Academy YouTube playlist. Please complete the post-session survey to provide both of us feedback on your thoughts of the session. Without further ado, let me introduce our wonderful speaker for today. So I am honored to introduce our guest speaker, Jennifer Walker from Kinder Ground. Jennifer brings a wealth of experience and a forward-thinking approach to animal care, specializing in strategies that prioritize both the health and welfare of livestock from day one. Today, Jen will be sharing insights on making better decisions sooner for Youngstock care. In an industry where early interventions and proactive management can mean the difference between thriving animals and chronic challenges, Jen's experience and expertise will help us rethink how and when we make critical care decisions. Her approach emphasizes not just reacting to problems, but putting prevention into action by anticipating needs and challenges to build a foundation of welfare-focused, efficient practices that benefit both the animals and the operation as a whole. I'm looking forward to an engaging session filled with practical takeaways that you all can apply on your farms with your clients and within your care teams. With that, please join me in welcoming Jennifer Walker. Take it away.
Thank you so much. Let me see. I'm going to see if I can share. All right. Let me make sure I got the right screen for you. Slideshow. There we go. How's that look?
It's coming through.
All right. Well, thank you guys so much. Very, very happy to take this time and share my thoughts on how we can make better decisions sooner for Youngstock care. I'll have a quick giveaway that I'm always a bit of a snarky one. So my backhanded title for this is "Killing Cows Sucks. It'll never be easy, but we can do better for the cows and their caregivers." And that's sort of my lighthearted way of getting at the fact that as an industry, I think we have an opportunity to help farmers learn how to and practice making better decisions sooner, not just for young stock, but for all the stock in our care. And some of this is really about helping veterinarians advocate for their patients and prevent suffering. And so I think this is a great example of where getting to good is a team effort. And so hopefully this will highlight that and kind of bring that home. I also want to highlight that, you know, in the original slide, it kind of had counterbalancing forces of economics and what I would call compassion. And just to lead the way on this discussion, I want to call out the fact that when we're talking about these topics and really hard topics on the farm, when it comes to making some critical decisions about the care of our cattle, I don't think it is necessarily a push and pull between economics and compassion. I think if we sort of look at it in a different lens like this, where compassion is sort of that centerpiece, compassion is at the center of the balance of finding how we manage the practicalities of animals and production systems and all the other things we have to balance on the farm. And we'll touch on that a little bit. Really quick, conflicts of interest disclaimer. As she mentioned, Jennifer Walker, I'm the co-founder of, and Chief Animal Welfare Officer for Kinder Ground. We're a nonprofit that works with farmers to implement better welfare practices on farm. And so just call that out and check out our website, but just that conflict of interest disclaimer. So really quick, just a roadmap for what we're gonna do today. And so to line out, the first thing we're gonna do is talk about some guideposts when we start thinking about these decisions and how we balance all of the things we have to manage within the business. Second, I want to do a quick pulse check, and I'm just going to put that little asterisk there as a highlight, but there's some sensitive material in here. So I just want to call that out to folks. Some of the images are can be upsetting, and I just want to put that out there. But I think it's important that we kind of look at these things with courage and not shy away from talking about them. Next, we'll talk about why we fail or why I think we're having these challenges. And then we'll move on to some what I jokingly call strategery or strategy. So what does it look like? How can we set ourselves up for success when it comes to managing these conversations? And then lastly, a bit of reflection, because I think that's important, just to pause, take stock in how we're doing and where we might need to adjust. So we'll get started with guideposts. And so I think it is important, like I recognize, to recognize the challenges we have. And so if we think about veterinarians in general, we have a professional duty. We took an oath. We all took an oath. And in that oath was a duty to public health and food safety, and that we advocate for the cow or the animals in our care. There's nothing in our oath that says that we are supposed to help our farmers make money. So that's a challenge, because there are inherent conflicts, professional conflicts, that we do have to manage, because at the same time, while we're doing this to carry out our oaths, we have to make money. We have to put food on the table as well. And then there's relationships. I think particularly in food animal medicine, we more than anyone, we see our clients sometimes every week, sometimes at least once a month. And so these are some long-term relationships that are important to us that we have to manage. And so I think just recognizing that there's conflicts of interest baked in the cake, that we can manage. And so I think it's impossible to get rid of all conflicts of interest. I think what's important about conflicts of interest is that we identify them and manage them. And so I think it's clear where we stand on veterinary medicine. I think it's a bit of a challenge, more on the farming side. And so when I have these conversations, I really try to put dairy farming and agriculture in general in this premise about the profession of dairy farming, and if we kind of look at it through the same lens, because I do think that in farming there is public safety, there is food safety, there's quality. I think there's similar challenges across the board. So I think if we can recognize those as we enter those conversations, that's really helpful. The second guidepost is just talking about animal welfare. And so just to level set on where we are. And so I think there's lots of definitions of animal welfare, and we've talked about like the 5 freedoms, and now everybody's talking about the 5 domains. I find those descriptions a wee bit too academic for my taste. And so when I'm talking to folks about animal welfare, I really just put it in these big buckets. So I'm a big bucket thinker. So the basics, animal health, and the animal's nature. And when we're talking about the basics, that's really abuse, neglect, timely euthanasia, humane slaughter, how we care for moribund or severely injured or animals with severe conditions. And then the second bucket is animal health. So are they healthy? Do they have access to food and water and protection from the elements? And the last bucket is their nature. So do we provide animals in our systems environments where they can express natural behavior to some degree? Are they free of pain? I might actually argue that would go in the basic bucket. But do they have an opportunity to express highly motivated behaviors? Do we have enrichment? Big picture, I mean, really big bucket is kind of put this under the quality of life point of view from the animal's perspective. And what I think is important is, there's lots of challenges that we have across in welfare, in agriculture, but it's not unique to agriculture. So whether you're dog, cats, chickens, zoo animals, right? All of these challenges, transport, breeding, veterinary care, the care of young, timely euthanasia, all of these topics that are important to talk about in animal production are equally important to talk about across every other animal species. So I like to remind folks that, yes, we have a lot to work on in agriculture, but we're not alone in that. So I don't think folks in agriculture should feel like we're, being picked on, or that we're performing, horribly in some of these areas, because every species, every sector have similar challenges. And so I just like to point that out, so we're kind of on the level playing field. The bulk of this topic moving forward is really about the basics, right? So when we talk about abuse and neglect, particularly timely euthanasia, and how to handle moribund animals, but more specifically animals with severe conditions, and what are the implications of that. And so I think it's important to set some ground rules, and so where I'm coming from. And so because these 3 ground rules define my approach to how I think we should manage these. So that's just, I think it's important to clarify that. And so you may not agree with these ground rules, but at least it'll give you baseline, or to understand perspective of where I'm coming from. And so rule number 1 is that death is not a welfare issue. Dying is. So the process of death, to experience a process of death, if it's prolonged, is the issue, and how we manage dying is the welfare issue. Transport is a hard process regardless. So we have to consider that when we're thinking about making decisions around fitness for transport or marketing our cattle. And lastly, and this might not be where we might not all agree, but this is foundational to my approach and my worldview and ethic, is that profit is not a justification for suffering. And so keep these 3 ground rules in mind as we sort of navigate this conversation, because these 3 ground rules really inform all of my decision making when it comes to trying to help farmers navigate this process. So the next thing we have is our little pulse check, right? And so just a reminder, there'll be some sensitive images that we're going to share here. And so a quick pulse check, high level, is to understand some of the data that we have. And if you think about the fact that for calves, so that's what the little bottle stands for. So in our neonatal animals, or our milk-fed calf population, depending on where you look, and you can look at the farm or look at the national data. National data would tell us that about we have experienced mortality of about 6.4% in our neonatal calves. And the best estimates we have about how many of those animals are actually euthanized on farm is 0.4. Right. With cows, we do a little bit better. So they have about a 5.6% mortality in adult cows, and about 2.4% of those animals are euthanized. So whether it's the 0.4 or the 2.4, we're not doing great when it comes to making timely euthanasia decisions. So what it's telling us is that the majority of the animals that die on farm are suffering through death, right? And so this goes to that principle number 1, to recognize that death is not a welfare issue, but dying is. And so these pictures represent various examples or times that I've been on farm working with farmers where we've had down cows that have just been left to die, or again, chronic, this getting to the heifer question, chronic heifers in this picture here, and here, where we have animals that have been sick, that have been treated, but that have not responded, and then have been just kind of left to get better. And so this kind of goes to that primary point, is that really the majority, approximately 78% of all on-farm mortalities suffer through death. I mean, I recognize that there are some sudden deaths, so we try to account for that in the math. But really, it from the best we can figure, it seems that about 78% of farm mortalities suffer through death, a prolonged death. And this is another case where just calling out what we call we often call the chronic pen, right? Depending, or the railer pen if you're in beef. And these animals that are chronic, that have conditions that are not going to resolve, where these animals kind of get put in the hospital pen or the chronic pen, and are then just kind of put there to see if they survive, I guess, to see if they can turn things around. And so the question I ask farmers when we look at this pen, the first question I ask is, okay, if we look at how many animals come into this pen, let's be honest and ask ourselves, is this a pen where animals go to get better? Or is this a pen where animals go to eventually die? And I think kind of having that looking at that with that clear-eyed question can help us figure out how we manage these, because I find that these pens become really a challenge, because they always have these sickly animals in them that if you're coming in, you might have even come in with one thing and you're going to end up getting something else, because it's just kind of a hotbed or soup of all of the things that are ailing the other animals on the farm. So this is where we do have that challenge of really making timely decisions for euthanasia. The second one is profit is not a justification for suffering. If we look at that premise, and understanding both that transport is a hard process regardless. And this highlights, I think, really what I see when I either go to this is a livestock market where there was a calf that was essentially non-weight bearing lame on her front leg, because I suspect that there was a fracture or something. That was sent to market. And so she had to navigate this market with 100 other calves that day, and was asked to walk around, and was asked to walk around a sale pen. And we have similar challenging decisions where we see animals sent to market and called that are emaciated, so they can't manage. Understanding that these animals really have to jostle and fight with other cows along the way, that they're really not in a good position or a good condition to fend for themselves on the journey. And it is a long journey for many of them, and we're going to touch on that a little bit. And then lastly, this is just an example of a cancer eye, where again the eye was allowed to get to an extreme case of cancer eye before she was sent. And so again, and there we can name all kinds of reasons and thought process that farmers might have decided to send these cows. But I think if we go back to these ground rules of profit is not a justification for suffering, and transport and understanding that transport is very difficult, that maybe we would have made different decisions if we had kind of put these decisions to those 3 litmus tests for that. Lastly, just to touch on this as far as a pulse check, is one thing that I do see that it's not necessarily related to timely euthanasia or making better decisions sooner. I think it has to do with making better decisions. And so just understanding that a little respect goes a long way. And when I talk to farmers and folks, I try to remind them that, like, the animals that we choose to send to market that go through the sale barns are a direct reflection of the care and compassion that they receive on our farms. And one of the things I say often, like, if you're not willing to write your name and phone number on that cow, then she probably shouldn't go, right? And so it becomes then difficult if I'm at a slaughterhouse or a sale barn, and I see things like this where the amount of graffiti that we have on the cows, whether it's adios here or writing $signs on them, right? None of that screams respect or compassion, right? So I think we should be mindful about the message we're sending externally, but also internally, because the employees that are writing this on the animals and treating the animals in this way, that is how they look at them, right? And so you can't help but that's going to inform behavior or manifest in behavior. So I think looking at these as cues to culture on the farm are key. So I think just paying attention to these little subtle signs of culture on the farm are important, but also, again, from an outward facing business perspective, I think very important for folks to think what we think of our cows. This is essentially this is our billboard that we're putting out there. And then lastly, just thinking about the pulse check from what we do see at slaughter. So if you're not familiar with the numbers, we have about 14% of dairy cows in the US beef supply. And there was based on the National Beef Quality Assurance audits that they did back in 2022, they found about 26% of those cattle were lame and 8% were severely lame. So 8% being not fit for transport and practically not able to bear weight, right? And so when we think about then that the average transport for cows in the system is about 6 hours, and that it can be up to 24 hours and over 1,000 miles. So keeping in mind that cows are not going to lay down, right? So cows will rarely lay down during transport. And so the impact of being severely lame during that process is massive. They didn't report in the 2022 BQA audit how many cows were too thin. All they did mention was that it was worse than 2016. So I don't know what that number is, but in 2016, the number was 9.3. So we didn't get better. So I think that's important to recognize. What does this mean though? Just a bunch of numbers. When I think about it, again, we have a cow who may have to travel as much as 24 hours standing in a trailer in a given day, on any given day. What that translates into is over 5,000 cows that are in a good bit of pain and lame trying to manage that trip. Another 1,700 a day that are practically crippled, right? So non-weight bearing lame on one leg that are trying to navigate a trailer ride, sometimes up to 24 hours, at least on average 6. And then about 2,000 cows a day that are coming through the system that are emaciated. And again, so these are cows that have to jostle for their space in the trailer, that may be not quite as strong, not quite have the energy to manage the journey, which again can be long. And this doesn't account for what I call sort of the ghost problems. And so those problems that we don't see. And so my greatest example of this is cows with displaced abomasums that are sent to slaughter without having that corrected in advance, even with a roll and toggle, right? So if you could imagine having a DA, which is painful, I don't think anybody would argue that having your stomach full of gas and twisted would not be painful. I think anyone who's ever had stomach aches would say like, oh, that's some pretty uncomfortable to experience. That we send those animals, and it might take up to 3-4 days before that animal actually reaches to the slaughter plant. And so keeping in mind these other challenges that we see in the supply chain. So that's kind of the pulse check and highlight kind of where we're doing. And I would say, I think it's fair to say we have room for improvement, right? So let's think about, like, before we start trying to figure out how to do better. I think, in my process is first to figure out why we're not doing as good as we'd like to, right? So why do we fail? And I appreciate that some folks will look at that and say, Jen, fail. I don't like the word fail. Failure is a strong word. But so why aren't we doing as well as we'd like to? And I think it's easy just to assume people just are bad, right? So, but I come to this assuming with the assumption that there is good intent, and I think that is important. And in through looking at this through that lens and having conversations with farmers, I've realized like some of the issues that have been a challenge, and so it brings me to this book by Atul Gawande called Being Mortal. And I highly recommend, you can get it on Audible or you can read it. I don't read as much as I should. I listen to a lot of books. This is an incredible book. He's a physician and a neurologist, I believe, or neurosurgeon. And it gets to the fail to plan, right? And so again, I assume good intent. And this book talks about the importance, and I think it is a book that anybody who is a parent or has parents, which means everybody, should read this book, because it goes through and talks about end of life care and how we can do better even as a society, and what are the challenges. And one of the things it talks about is that everybody has their different red line, and understanding what it takes for people to be happy and content with their life. Like, what's your red line? And I think having these conversations are important for us to just manage our families, businesses, and by business, I mean end of life decisions. And in this book, he noted several different approaches. So in one person he talked to, when he said, like, what do you need to live? Like, what's your red line? And this person literally said, as long as I can eat ice cream and watch football, I want to be alive. I want you to save me. I want you to do everything I can. And then there's other folks that are like on even the more extreme, that like, I want to be frozen, right? I want to be like Michael Jackson. I want you to freeze me so that just in case they can figure out how to bring people back, you can bring me back. And you're like, okay, there's another extreme. And then there's folks like me who honestly say, if I am not of my right mind and I can't take care of myself, and if I cannot contribute to society, I'm done. I don't want extreme measures. I don't want anything, right? And I apologize if for some of you who think this is morbid conversations, but it wasn't until this book, listening to this book, that I realized the bias that I bring to the table, right? So not only do we not have these hard conversations and figure out a plan, I realized for me, every time I have a conversation with a farmer, I was bringing my bias of my red line to the table, and that hindered progress in in managing it. Um, I failed to imagine, right? I wasn't open minded. I wasn't able to think like, why would a farmer not want to make this decision? Well, it's because they're bringing to the table their thoughts about their red line. And so to get on with this is the poll question I was going to start off with. I'm just curious, in this group of folks who are participating right now, what is your red line if you're thinking about end of life decisions? Is it as long as I can eat ice cream and watch football? Is it as long as I can communicate and have a clear mind? Is it as long as I'm contributing to society? Or do you want to be frozen and chill with Michael Jackson? And I realize you may not like any of these answers, but just pick one. But I think part of it is grounding in just this realization that not everyone can not everyone brings their own bias to the table. So we'll see. Or I don't know how to get the answers. You can.
Yep, I got it up. So I
Okay,
will
perfect.
right now we have it sitting at three people said as long as I can communicate and have a clear mind, and one
Okay.
said as long as I'm contributing to society. So I'll close it in
Okay. Fair enough.
yeah, a couple seconds.
Okay. Perfect. Yeah. And so just from that, I think you can see, right? If you can imagine that now, how that informs how we approach some of these really hard decisions. And it really wasn't until I had this book kind of knock me on the head and think like, oh, you know what? Like, I guess speaks a lot to me and how self-absorbed I am. Like, no, Jen, not everybody thinks like you, right? So I think having these conversations with farmers is key. And I've had these conversations now since, and it's opened doors to helping farmers figure out the plan, right? Which I think is very important. And all of a sudden my thing doesn't want to go. Oh, there we go. Let's see if that works. Okay, there we go. So I do think that that is a large reason why we fail to get this right. Because we haven't navigated those conversations and recognized those challenges and had those hard conversations, how sometimes our personal bias may not serve us well in making these decisions in an animal production perspective, right? So a little bit different perspective. So let's take what we learned there and then talk about a strategy about what we can do. I think that one of the challenges that we see is that some farms have a process for identifying voluntary calls, but very few actually have a strategy, right? And so in order for us to make better decisions sooner, we do have to kind of sit down and really talk through how we want to approach it. And so I do think that first is recognizing that there should be two strategies. There should be a strategy for our voluntary calls, and then we have to have a different strategy for our involuntary calls. And the important part here is that in order to get this right, we're going to need some basics first, right? So the first thing we need to do is have records, because we need to be able to look at and track calling and euthanasia patterns, right? Because if we have records, it's gonna help us identify patterns and also help us identify and reveal management gaps as we go through about what's happening. So having good data about the reason animals are called and how many animals, which animals are euthanized and why and when they're euthanized. The third key is there really does have to be a lot of forethought, right? And along this goes those clear limitations. And so the forethought includes having these hard discussions to unearth bias, to unearth challenges that folks are having with making some of these decisions, because some of it they just can't, right? So I've worked with some farmers who have just said, I just can't do it. I just can't. That is okay. Then we just have to figure out, how do we get it done? Like, how do we manage it? That's fine. But us ignoring the fact that a farmer is very uncomfortable making these decisions or doing the act of euthanizing animal is key, right? So having the forethought in these hard conversations and setting clear limitations. And again, for me, it goes back to those three rules of recognizing that we talked about at the beginning, that death is not a welfare issue, but dying is, that we cannot justify suffering for profit, and that transport is a challenge regardless. The next thing we need to do is then have a consistent application of what we've decided, how we want to approach it, right? So then we have to have a plan to get that done consistently. And then again, our records will help us monitor that. But in order to get there, we have to have training and that oversight. And when I say training, I mean train, and retrain again. And that is everyone. There are programs, or like I think the farm program, it specifies that you have to train everybody who's responsible for euthanasia or responsible for down cows on that SOP. I'm a firm believer that everybody on the farm needs to be trained on fitness for transport, on euthanasia, on down cow care, because everyone should know what good looks like. Everyone should know what they're responsible for. That no, this is how we do it, and it's not your job, right? So I think that's very key. So training and retraining everybody to make sure that we come back and make sure that we're monitoring it. And this is where oversight comes in. And that's where I do think that every dairy should have a chief animal welfare officer. And ideally that's your veterinary of record. That's what they're there for. They should be walking your chronic pen. They should be walking your calves every time they're at the farm to help you identify these things, because it is not unsurprising that when you're deep in it, when you're up to your eyeballs and all this stuff, that you don't see some of these things, because things kind of slowly change, right? Things don't go from okay to bad overnight most times, right? Usually there's a gradual change. And particularly when we're talking about treating calves, treating our young stock, they don't generally go oftentimes from looking great to looking bad. There are some of those diseases that do that, but on some of these more chronic decisions, you're highly invested, you've been working on them, and it's hard, you see that little bit of better, right? She looks a little bit better than yesterday. So I think it's helpful to have somebody come in with fresh eyes, and be able to take a look and see that. So those are what I think we need to do to put in place. The perspective we need to take is threefold, right? So I think it's always important to figure out, like, who are we trying to how do we figure this out? And I think to do this, we need to take the cow's perspective, right? And with that understanding that, like, from the cow's perspective, above all else, the cow is going to say, I would like to avoid or minimize suffering. I think that's a fair conclusion. If we take the consumer's perspective, because again, remember, we are a consumer facing industry. We have a product to sell. We need to make sure that they're happy, or that they, I should not say that, not that they're happy, but we want to make sure that they trust us, right? We want to maintain that trust. We want to make sure that they believe and can believe and trust that we are doing the best for the animals in our care. And again, they expect that we assure quality and food safety, but they also expect that we avoid or minimize suffering. They don't expect us to be perfect by any stretch of the imagination, but they do expect us to meet the moment when it comes to this. And then from the farmer's perspective, again, it's a little bit more complex, because of course it's a business. You need to protect the brand, you need to protect your farm. And of course you want to maximize your return on investment. I mean, again, you're in this, you need to make a living, you got families and kids to put through college, and that is okay. What we need to do is try to make it the best decision we can with the situation that we have. So then again, if we put this in mind, I think it's also important that we reflect on, we need to avoid or minimize suffering of the cow, but we also need to avoid or minimize suffering of the human at the other end of this conversation. So just a reminder, we're gonna circle back to this. The timely euthanasia is defined by euthanizing this animal as soon as the need is identified and can be done in a safe manner. So managing safety may require that we relocate the animal or wait for a trained person to arrive. So that is key. So that is not just avoid and minimize suffering for the cow. We do need to remember that there's a person in this equation that we have to consider. This is some work done by Dr. Roman Muniz and Dr. Calloway. where they talked about making these decisions. And I just think that it's important again to reflect on this human component, particularly when it comes to Youngstock. I think it's just so much harder. And this last quote, you have a cow that you've taken care of and who's worked with you and helped you have a nice business and take care of your family. And it's hard when you see that old cow or young cow and looks at you like, I just don't feel good, right? So I think that again, just recognizing that these are hard decisions is step one. And so we haven't forgotten that, because I think sometimes even me, I can talk about this in a very, my logical hat on, and we have a process, right? Whatever the logic is, whatever the process is, it's still hard. It's still hard. So from a strategy perspective, this is just my example of a calf, an SOP when I look at managing calf health. And you're going to see it's not complicated. I think my frustration when we look at so many SOPs, particularly that veterinarians write, we write the worst SOPs. I always joke that it's like you'd think we were launching a rocket, for NASA. They don't need to be that complicated. And I think the first mistake we make is that we try to write SOPs that account for every possible iteration and situation. And that is impossible. And then it makes for SOPs that nobody's going to use or follow. So I try to keep SOPs very basic, and mostly so that we're going to have touch points, right? And this is just, again, a high level, but it starts with the question. And I think these two questions, you can, work with a veterinarian and create all kinds of other steps to this SOP, or approach it differently from a time-wise perspective. Maybe you treat and monitor twice a day. But to me, asking these first two questions are critical. What are the chances of recovery? And can I manage pain and comfort during the recovery? Because these two address the main issues of, let's be honest, we're in the production business. And so we need an animal that is going to return to production or grow to be a productive animal. And I think recognizing that is key, and making sure that while she's in this period of recovery, we're not actually, again, affecting other animals and risking the health of other animals. And so I'm not going to dive deep into this, and I'm happy to share it with anybody who wants it. I do want to call out specifically here, I just divided it into our big main problems that I see on the farms, right? Calves, what do they get? They get diarrhea or pneumonia. That's pretty much it. And we could, kind of follow from there. The other one is contracted tendons or other birth defects. And this is where I've seen a lot of issues with folks sending animals with contracted tendons to the sale. And so I think it's just, I put this in here to call out that these animals are not fit for transport because they cannot bear weight evenly and stand squarely on all four legs. And so if they cannot do that, we should not be sending them through the sale barn. We should not be sending them on a trailer for slaughter. And so you can work with them and see if they get better. But if they do not get better, that they are not fit for transport. And I just wanted to call that out. Lastly on this, to make this successful, if we get to this point of euthanasia when we've had sick animals, necropsy. I see there is so much information that we lose by not really doing a necropsy. There's lots of assumptions about why animals die. There's a lot that can be learned from a necropsy. In practice, nearly all of my farms that I worked with, and this was moons ago, but it was just our policy that if something died, unless it was like, again, from a broken leg or some sudden death kind of thing, broken leg or injury, then we did a necropsy. We didn't necessarily have to send everything in for tests, but we wanted to look, because I was amazed the things that we found that we had assumed that it was sick for one thing and it turned out to be something else. So I just want to call out that, again, that value of your veterinary record and your chief animal welfare officer providing that service. Then we get to the hard decisions: euthanize or continue to treat. And again, I start here with questions, right? So the big questions, we get back to the similar questions that we had on treating the calf is the cow comfortable, and can I manage the pain, right? The two key questions, because from there, then we can teach people, what do we look for? How do we manage that? So then again, for the train people on what does comfortable look like, right? What does comfortable look like? What does pain look like? Are we sure that everybody understands what pain looks like in cows and calves, right? I see folks like when teeth grinding, a lot of folks don't recognize that that's a sign of pain. And then asking these questions again, does the cow look better today than yesterday. If the answer is no, but I can improve, but I can do better, right? Not that she can do better necessarily, but no, she doesn't look better, but I think I could try harder. I think I could try something else, or I'll talk to the vet and we'll change treatment. That's great. We can continue to check and work on that. But if we can go through there and say, no, she doesn't look better, and you've done your best. We've done all we can, then we say, like, okay, it's okay to euthanize. And then again, if she looks better, great, keep going. To me, these are the kind of SOPs that help us make better decisions, because if we get to this point here to euthanizing immediately, what I have found is that if we give folks this process and this thought process to go through, it's permission, right? It's permission to say, I've done my best. We can euthanize this animal. And so often I have found that that is the barrier. That is the barrier, because it is like admitting failure, right? But if we can say you haven't failed, you've done your best, right? And sometimes our best just doesn't work, is the key. We're not going to do this poll, but I am curious, like, when your vet, just think about this. If your vet does walk through and check the hospital pen and calves every time they visit, if the answer is no, I would have a chat with your veterinary record and just say, hey, from now on, when you come, I just want to make sure you walk the hospital and let's go take a look at the calves every time you visit. You'll be amazed how that pays off and how you get going. Okay, and lastly, if I stay with time, some reflection. Again, just thinking about like what those red lines are. Think to yourself, do you feel bad or do you hesitate when asking your veterinarian to euthanize cows? Or if you're a veterinarian on this listening to this, do you offer or recommend euthanasia, or are you waiting? You're like, well, if the farm wants it, they'll let me know, right? So pause and ask these questions, because again, when I talk, I was surprised as I started asking these questions of farmers that yes, they do feel bad. They don't want to ask the vet to do it. Nobody likes euthanizing cows, right? Nobody likes making these decisions. And so recognizing, that a farmer shouldn't feel bad. And if you're the vet, make sure you recognize that hesitation and make sure that you offer, make sure you're going through. So I think having those conversations with your veterinarian of record is key and will help you manage this. This is another sensitive video I want to share with you, because I also want to highlight again the importance of training and retraining, right? So this is an example of a calf that was euthanized by a caregiver who was doing her level best. And so you can see that this calf is a very large joint. The calf wasn't doing well. When I do animal welfare audits, I do look at the mortality area and I check to make sure that not only that everything is in fact dead, but I look at the method of euthanasia. And it turns out that this calf was still alive. And it turns out that this calf had been actually euthanized, or attempted to be euthanized, a day before. So it had been sitting there, not quite euthanized, for over a day. Needless to say, the caregiver was just heartbroken. She felt terrible. So I just want to point out that this was not done with malice. This was not done with a lack of care. This was done with the utmost care, right? But she didn't know how to do it. She wasn't responsible for euthanizing cows, but everybody was away, and she felt so bad for this calf that she just thought, I have to do it. And I've seen it done enough. I know what to do, right? And she didn't know what to do, right? So, and because she hadn't had the training, she wasn't familiar with how to check, to see if an animal is dead and expired. And this is another example. So this is me checking for a corneal reflex. And so this cow, again, this was another calf that I was asked to necropsy actually. And I said, well, she's not dead. The caregiver knew to check the corneal reflex, and the calf had no reflex. And you can't really see it here, but her heart, she wasn't barely breathing, but she had a heartbeat, right? So what I teach to the caregivers is my little acronym of, you got to check her out, right? So heartbeat, eye reflex, and respiration. So we got to check her out before we do anything, before we move her. Make sure that she is in fact gone, right? And this is a huge, like, the number of times I've gone through this and the number of times I've shown people that the calf is not actually yet dead, you could just see the heartbreak, right? Of how many times they think like, oh my gosh, I had no idea, right? So this is again where we can step in and help and empower our folks to do a better job. I'm going to, just to save us time for conversation, I'm going to go quickly through why I think we make these wrong decisions or why we have a challenge to make better decisions sooner. I do think there are externalities here where, again, we have animals that go to sale, whether it's young stock or cows that get to the sale, and there is no disincentive, right? So if they go through the process, it clearly sends a signal to the farmer that it's okay, right? There are wrong incentives, right? So you avoid euthanasia, so you get to avoid killing it. You don't have to dispose of it. You may or may not actually get a profit off of it, right? And there is profit in what folks would call marginal cattle, or what I would call not fit for transport. Um, and we really have not done a great job at making sure that the incentives for better decisions, making better decisions sooner, is clear, right? So there are benefits to this. There are benefits to this. We just need to work with our farms to do it. And recognizing that, again, if you go back to my 3 rules, my fundamental rules, that this is just the cost of doing business, reinforcing that and helping folks incorporate that in their daily decision. And so lastly, again, we talked about the perspective and making better decisions sooner. I do think we also need to talk about recognizing and managing compassion fatigue and acknowledging that there is moral stress in making these decisions. And so trying to find ways where caregivers, the people that we charge to take care of the cows day in and day out, and this is harder on smaller farms because we don't have that many people, right? But understanding, particularly from a veterinarian point of view, because we're coming in, right? Understanding that we should not expect caregivers to necessarily be that driver and part of that culling decision. Or they should be a part of it, but they should not be responsible for the decision or the act. And so we can talk to them about it because we need to make sure that they understand. Again, is the question, did we do the best we could? And creating that permission structure so that it doesn't feel like a failure, right? So part of the discussion, but not responsible for the act, I think is key, because that starts to warp some of our decisions when we do that. But then just recognizing on every front, whether it's the veterinarian or the farmer who has to do it, that there is moral stress. And so I think providing relief from duties of euthanasia is key. So if you're on a larger farm, having the ability to rotate who's responsible for that, or asking your veterinarian to come and do it. I had 2 clients in practice that, again, like just said, I can't do it. And so that was my job. If they had an animal to euthanize, I showed up. And it was hard. It was hard. I'm not going to say it wasn't hard on me. But I was happy to do it for the farmer and for the animal to make sure that we handled that. And that's the agreement we came upon. And so I think having these conversations and creating space for those conversations is key in order for us to manage this well. So again, this is a quote from Dr. Muniz's paper that was amazing. So again, if I kill a cow, they say, poor thing, why did you kill it? It's that they don't know that it was suffering. So again, this employee is referring to his family's reactions when he tells them he needed to euthanize a cow. So again, I think recognizing the humanity in this process as well. We want to avoid suffering on all fronts. And so we need to make sure that we manage that compassion fatigue and moral fatigue as we go on. So with that, I just want to thank you. I appreciate that this isn't the most cheerful topic for your week. So I appreciate all of you that have stayed and listened. And happy that we saved time and happy to have time for questions as we go.
Thank you so much for sharing your work and your perspectives on this. I always appreciate your insight. And I mean, off the bat, you started off with where, death is not a welfare issue. It's the process of dying.
Yeah.
And I'm just like, all right, we're getting right into this.
I've never been accused of being subtle. So
that is a wonderful characteristic though, because especially with this topic, it's sometimes a lot of people are very nervous to talk about it. And I think we need these vehicles in place, whether it's webinars, conferences, to just say, hey, this is a place where we are going to openly talk about this and having those conversations. And when you were talking about your chief animal welfare officer, with the with a conversation that's happening where, rural veterinarians, they're far and few between now. It's so hard to get new ones in. Is there opportunity for um a respected individual in the farming community and in the dairy community that could take on that role, whether it may not necessarily be a singular individual employee on a farm. It could be a whatever the term, consultant, advisor, who could potentially come in as an animal welfare officer. And secondly, could they be performing those necropsies? Because I hear it also again that vets are so swamped and just time crunch. Is that an opportunity? What are your thoughts on that kind of approach?
Yeah, no, I think it's a fair question because I'll give that argument some weight in some areas and
Yeah.
sometimes not so much in another. And so I do think figuring that out, and is it a local person who can come in and help provide that, right? And just say, hey, and so, I don't want to like put all the work on extension agents, but like, is it an extension agent? Is it a
Yeah.
local FFA? Like there's other folks in the community, right? That I think you can kind of build that network or work with your veterinarian to say, like, is there somebody? Your vet might not be that available, but do they have a technician? Right. So
Hmm.
there's opportunities for vet techs and vet assistants and things like that. And then I do think on some farms, like I will just say, there's two things to that too, is again, first, let's make sure we don't make an assumption. Like one of the farms I was
Hmm.
at recently, the person just kept saying they're too busy. And I said, it's fine. Like, do you think he's too busy? Has he actually told you he's too busy? Because I feel like you're just being polite, right? But then I did another farm, and as I was working on some calf stuff, the fellow kept asking me, do you have time? Do you have, and he like if he asked once, he asked
Oh.
15 times. And I kind of like I walked away like, okay, you clearly have the message, whatever that message is, that these people are too busy for you. And I think recognizing that, and I have a bias for that, or I'm extra sensitive to it, because when I started practice, the one thing my boss, I remember, I mean, there was lots of issues there, but the one thing he told me, he's like, you never tell clients we're too busy if they ask you. And
Mm.
so I will never, like, I could be busier than busy. And if they ask me, Jen, do you have time? I might say, I have to go. I don't have time in this moment, but my answer was always, I always have time for you.
Mm.
And so I can come back later, right? And if it's like, I'll come back later, no, I'm not going to charge you for another call fee. That's on me because I'm busy.
Right.
But it worried me that when people are thinking like they're too busy, so then they don't ask. And I think it's our job to have that self-awareness about like what is the message we're sending to
Hmm.
the farmer. But this guy also when I did an necropsy, he knew so much. He could do, like he knew how to do it. And I'm like, oh, you could take pictures, you could send us
Right.
stuff. Because I'm not gonna lie, I just sent the pictures to my pathologist friend because guess what? I don't know everything either. So if we
Yeah.
could we could teach somebody to do the stuff and take the pictures and be like, oh, like and
Is this a
like
funny color I should be concerned about?
exactly. Like, does that look normal? Because I sent the pictures to my friend, like, I don't know. I haven't done this in a while. So I'm like, this looks bad to
Right.
me. And so I think trying to solve those problems that way, like there's lots of unique ways to get at it. But I
Hmm.
think first is like making sure that you know, we need to be careful as veterinarians of not sending the wrong message. And then again, if your vet's too busy, then fine, like whatever.
Right, right. If there's too
But
busy, there
then let's
needs to
solve
be
the
another
problem.
solution. You're right,
Yeah, then we
right.
have to
Like
solve the
let's figure
problem.
out
Yeah.
what's another way to go about this so we're
Yeah.
not um, you know, I'm losing the word, but
Whistling by the graveyard, as they say.
right, right,
Yeah.
exactly. We're not compromising
Yeah.
any part of our, management decisions or,
Yeah.
all of that.
Yeah, exactly.
Um, yeah. All right. We did have a question come in. So,
Mhm.
what method of euthanasia is more humane? People use many ways, such as gunshot or firearm or captive bolt, formalin IV. This
No,
one
that's not
says,
okay.
yeah, lidocaine in the
Okay.
spine, followed by xylazine. Please share your thoughts. I don't, and I also don't know based off of this question if this is outside of the United States or not.
Oh,
So
good. Okay,
that
that'd be
might be
it.
another piece to that.
Yeah.
So it
So
might
yeah,
be
so I
different
will.
regulations. So
Good. I see you're smarter than me. You're better at this than I am. Yeah. So if you're in the US, I will say if you were in the US, there are like as I say, there are a million ways. What's the song? There's a million ways to leave your lover. There is three ways to kill a cat.
yeah.
That's it. We have three choices. One is euthanasia by overdose of pentobarbital. Second is by firearm. third is by captive bolt. There has been now looking at like this whole intrathecal injection of lidocaine that then follows up with xylazine. I guess that's on the list. I find that to be highly impractical and
Yeah.
I don't know who's going to do that. Maybe at a I think that came along when universities were short on kind of barbital or
Okay.
euthanasia solution, and like the university's like, you can't have a gun here. It's like, so we were having
Right.
challenges of like, how do you euthanize
So
something
what's a
if
backup
you,
to the backup?
so what's a backup to the backup? So I find all those other ways impractical. Things like IV formalin, IV anything else, potassium chloride, without the first that, like, you have to render an animal unconscious first, and so that's what a captive bolt gun done does. I think the big issue here is, so to me the most humane ways is either a firearm or captive bolt. Either way, I have adopted a philosophy that no matter which method you're using, you shoot twice to make sure. So we get it done. Like I'm not even, I spend a lot of time training, like how to make sure, when do we do it twice? I just forget it. Just, it's a
Just
bullet.
do it
Just do
twice.
it twice. Just let's move on and get it done. So that's, and then to me, the next question is really your comfort level. So I have to admit, I am not a firearm person. You don't want me to, I always joke with my friends, if you ever see me with one, you better run because something has gone horribly wrong. Like if I am not a firearm person. I am comfortable operating a captive bolt ish. I would say I used to be more comfortable when I did it more often. But I think choosing your method and then training to it and practicing it and getting that comfort level, because now is not the time to be fumbling, right?
Right.
When you
Right.
show up, it's like, how do I work this thing? If you have a new one, like my
Yeah,
friends at the Humane
especially.
Handling Institute, they were showing me, because I had used a different one.
hmm
And so they were showing me like
Have you
their
used
better
the pistol
option.
grip?
I like the pistol grip
Right.
because the business end is obvious, right?
Right.
Because otherwise it scares me. But the folks at the Humane Handling Institute have let me know, like, well, that one isn't really the best tool. So if you're going to be euthanizing a good number of cows, that they would opt for the like the straight
hmm
version, whatever that's called, which is great. But then I need some training, like,
Right.
which is what they do a great job doing that. So, but
Right.
yeah, so I would those again. I feel like in other countries the same, the rules are the same, but just in case I don't, yeah,
Right. There's
but
different regulations.
yeah.
Yeah. Yep. Yeah. When we, so we have a program where we actually train first responders on how
Okay.
to use a captive bolt device, in the situation where a veterinarian can't come out or, there's an animal in
Excellent.
extreme distress. Yeah. And so it's been a very, very, impactful program for everybody across the board. And we've had some folks who are much more comfortable with the pistol grip because it's very similar to what the
Mm,
firearms that they carry. And so when we go through that training, it's a little bit of a different retraining because they're used to a firearm, and
yeah.
with the captive bolt device, there's a little bit different handling to it, but it's very um I think it's very insightful from both folks who are, the first responders who are using the device for the first time, and also the folks who are a little bit more trained, a little bit more familiar and understand that. They see, oh, we see the full picture. And I'm like,
Yeah.
yes. Yeah. And
Yeah.
we always say at the very end, just like how you said, it's based on your comfort level. You may have this certificate to say that you're trained, but in that moment, if you say, I can't do this, okay, put it down.
Yeah.
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 There's
Exactly.
and that's a massive, and that's what I reiterate time and time again to anybody that I'm training. I'm like, you may have done hours and hours and hours to say you know what you're doing, but also when it comes down to it, that
Yeah.
there's always that moment where you might have to
You
check
have to be.
yourself. Yeah.
Yeah.
You
You
have to
have to
be
be
honest with
comfortable.
yourself.
Yeah.
Yeah.
And otherwise it
Absolutely.
just doesn't work. It's when we make mistakes.
Right. Right.
So
Awesome. Um, well, I don't have any more questions that have come in. So thank you so, so much for making the time to come in today. And I know we had to do some travel webinar
it's
magic,
all right. It
but it
worked
all
out
worked
great.
out. Yeah, it all really worked out. So
It worked
I
out
would like
great.
to also thank our folks who came and joined us today, and participated in the webinar and our poll questions. So I really appreciate the folks who show up, and I recognize quite a few of the names. So it's really nice to see some folks again and again. And with that, I will send you all off to have a wonderful rest of your day. And thank you, Dr. Jen, so much for sharing your insight and your wisdom and all the wonderful work you do.
Thank you, Cora. Thanks all for showing up, and feel free to connect and contact. Happy to chat.
Oh, yes, actually, I will share this last slide super, super quick. So that's
There you go.
that's on me.
You're
So
good.
if some of the folks if you have a chance, scan the QR code. But yes, that also has our contact information on there. So feel free to reach out to either one of us if you do have follow-up questions. So,
Well
all right,
done.
now I will send you all off on your day.
Thanks, Cora.
Wonderful. Thank you. Bye-bye.